So primarily for stroke prevention is to be on anticoagulation or blood thinner.
Any special ones? We used to use Coumadin a lot.
Right, we use Coumadin a lot. Mostly we use now the newer drugs, which are drugs like Eliquis or Xarelto or Pradaxa. Those are the newer ones. Tend to be more predictable than, and doesn't involve interaction with your diet, for example. So we tend to use those. Atrial fibrillation is more and more in older people. You know, good news, bad news. We have an older population, which is wonderful.
Yeah, we're getting older and older and older, so our chances of getting atrial fib are better and better and better.
Yes.
And when we get it at old age, is it harder to figure out to keep the patient well?
It is, because, for example, with those blood thinners, the older population may have trouble with bleeding or falls or becoming anemic. So we also have a procedure, it's called a Watchman procedure, and that is a catheter procedure that goes into the atrium.
That's the upper chamber.
Yes, and it's a type of plug. It goes into the appendage. It's a pouch where the blood clots are.
You say the appendage now.
Yes.
The upper chamber of the left atrium has a little dog ear.
It does.
Is that what, that's
yes.
what I've always called it. And that's where the problem frequently gets to be that there's a clot.
That's right.
And what does the Watchman do?
So the Watchman essentially is a plug. So where that appendage is, the Watchman is a plug. And so it's a catheter procedure to place a plug. And that is an alternative for people that cannot take a good quality blood thinner.
Is it difficult to put in a Watchman? You have to put it, you have to do a catheterization to get it into the heart.
That's right.
And into the right location where you let it stay there.
Exactly, and it's a very precise procedure. We use X-ray and we use ultrasound, and it's generally an outpatient type procedure.